I don't know if it's a suitable phrase, suitable rural healthcare, because healthcare should be suitable across the whole board. Yes, we choose to live here, but where else would we be? This is home. And healthcare should be available to everybody, no matter where you live.
I'm Tiarne, I live in Barcaldine and I have 2 kids. Paisley, she's 2.5, and Percy, he's 1. So I have a heart disease called SVT. I have some PVCs also, which are another type of extra beat. It's not really common in young people, so mostly elderly people do have what I have. I'm just a lucky one. I have had 3 surgeries in the past. I think I was 18 or 19 when I had my first one, and then I had another one the next year, and then I had one just this August gone, which was 9 hours, very painful. Yes, they hate when we go to the city because I don't have this area to play in. He's got the biggest smile, hey? He gets that off his dad. Yeah, well, Percy's still breastfed. I've never left Paisley unless I was in hospital. My family are on a property out of town, so I don't really have anyone in town that I can just say, here, can you have my kids? I have to go somewhere, you know, they have to come, we can't just leave them. Being rural, they can't do a lot here, so I can have appointments with the GP, and for my appointments I have to usually go all the way to Brisbane. Sometimes I can wait in the hospital for 2.5 hours and I see them for 10 minutes and then I'm out and I have to get a plane home. It's pretty crazy that we live here. In the past, I would have to drive either to Longreach or Emerald, so an hour or 3 hours to get a Holter monitor put on for 24 hours and then have to get it off again the next day. So now that they have the telehealth here, I can just go up to the hospital here, which is 2 streets away, and I can get it put on and they can check it all through the telehealth and they can read it straight away from down there when the machine's here.
Hello, my name is Tiffany Roberts and I'm the Consultant Cardiac Scientist for the Telecardiac Investigations Program. Telecardiac Investigations is using telehealth to be able to perform cardiac investigations to all Queenslanders regardless of the geographical location. So it doesn't matter whether they live in Mount Isa, Longreach, Mornington Island, they're getting the exact same care for Holter monitoring and exercise stress testing as patients living in Brisbane would. So we're able to use telehealth and video in using high definition camera and microphone. We're able to see the patient as they're having the test performed. So we're virtually in the room with the patient at the time of testing, which is awesome. It allows us to communicate to the treating team, to the local nursing staff and the doctors, and basically provide the best possible care for those patients living in rural and remote locations in Queensland. Pre-telehealth, what we were finding is we were getting the reports emailed to us. The cardiology registrar here would have a look through the report, and it was difficult for them to actually do a full comprehensive analysis because they weren't there and they couldn't judge certain aspects. So for example, if a patient had a drop in blood pressure during the test and they were using an automatic blood pressure machine, it became difficult for the cardiology registrar to know if that was a proper significant drop or whether it was just a fault in machinery. And by allowing the cardiology registrar and the cardiology team to be there at the time, it does allow them context and a bit more information. And at the time, if there is anything that's picked up significantly, they can address it straight away with the team. It's a no-brainer. Why should one person have one level of care if they're living in Brisbane and another person have another level of care living in Barcaldine? It should be the exact same, and we should be trying to strive to provide the best possible care.
It saves me a lot of time and a lot of money. I don't have to drive an hour or 3 hours to get a Holter monitor put on, or fly 3 hours with 2 kids to Brisbane. to live out here, people might say it's our choice, and it is our choice, it's a lifestyle we love, but if they want to have a steak on their plate, someone's got to do it. So next time they eat a steak, I hope they remember where it's come from when they say that if we have illnesses, we live here. Yeah, it is tough when you do have a medical history or any conditions. Obviously, I can't go down by myself with the kids, especially with COVID. I can't take them into the hospital, so someone has to look after them. So this is Megan, this is my mum. She gets dragged along to all the Brisbane trips.
Yes. That's a big thing. Support plays a major role in healthcare and recovery and treatments, because without your family support, you struggle. You need your family there. And there were times where I couldn't go. And so hubby would have to take time off work, or her mother-in-law would take time off work, but someone would always have to travel with her because she's not allowed to travel alone. So family plays a huge role in the healthcare, and you need, to have telehealth. It's something she can do on her own. And if she does need someone else there, there's someone only a few minutes away. It's hard, it's really hard, it's, you'd never call it a burden because it's just what you do. And I've been told I just take it in my stride, and you just take, you just take every moment as it comes. Yeah. Sorry, it gets a bit hard, a bit much at times. But you wouldn't not do it. You're there to support your family all the time. Hey, miss.
I always ask when I go to the doctor and they say, oh, you need to see the specialist, and I say, can it be done by telehealth? Because I don't want to go to Brisbane, I don't want to go to the city, it's too hard, I just want to stay here, and they usually say yes. So I've made lots of good use out of telehealth, I will say that. It's been great.